Hello and welcome back to the No More Trauma podcast. My name is Tanya, trauma survivor, certified trauma informed yoga teacher, coach, and wellness facilitator. My mission is to provide you healing, mental health tips, and inspiration for living a trauma free lifestyle. You can find this podcast on Apple, SoundCloud, and on YouTube. So, hello everyone for tuning in. Today we are introducing a new series that I'm very excited about. This series is called the, excuse me, I'm just kind of moving some things around here on my laptop. So the series is called A Treatment Plan and Options from a Trauma-Informed Clinical Yoga Therapist Perspective. So then you say that's a mouthful. And you're probably asking yourself, what is uh, the purpose of this podcast and the treatment plan? Well, the purpose is really gathering medical diagnosis and challenges and applying a yogic perspective, wellness options, and inspiration for achieving the overall goal of healing and vitality. Now, I do want to offer a disclaimer and just say that this episode is not considered treatment of your personal diagnosis. So you still want to consult with your naturopath or physician for more information. The information I provide is from a personal research, my own personal research, and a kind of the assigned case study as a clinical yoga therapy student. So I'll introduce again the definition of what yoga therapy is. Because if it's your first time listening and you're probably saying, wait a minute, wait a minute, wait a minute, there's clinical yoga therapy. What is that? Well, yoga therapy is a type of therapy that uses yoga postures, breathing exercises, meditation, and guided imagery to improve mental and physical health. So the holistic focus of yoga therapy encourages integration of the mind, body, and spirit. Okay. So modern yoga therapy covers a broad range of therapeutic modalities, and that can be anything from both the physical therapy as well as the psychotherapy. So looking more into that mental space. So now that we know what it is, so let's look at our diagnosis and our subject, right? So today's topic, we're looking at prostate cancer. And so prostate cancer, we're looking at our subject, and that is a male of about 65 years old. And so the prostate cancer is a growth tissue formed in the prostate gland in front of the rectum and right below the bladder. This is a type of cancer that usually occurs in men. Okay? So the overall goal is to reduce any discomfort and balance the mood. So we'll take a look, and I do apologize if you may hear any sounds behind me. So I just ask that you give me any patience and grace. So looking at the symptoms, we look at the physical symptoms. And so the prostate cancer may not, anyone that may be diagnosed with prostate cancer, it may not interrupt daily activity. So may still be able to move around and navigate the world and have a daily lifestyle without any physical interruption. However, some changes may occur in the urinary tract, the male libido, and cause inflammation in the lymphatic system. So bone tenderness is also very common. The mental symptoms that someone may experience with prostate cancer diagnosis or recovery is that the mental state can be disrupted with depressive symptoms, anxiety, and overall mood imbalance or irritability. So, in this treatment plan, after I gathered my information and I decided to create a treatment plan with anyone diagnosed or recovering from prostate cancer. And so I look at the amount of sessions I would like to have with someone. And so the sessions I would look at about 6 sessions. So that's 6 1-hour sessions bi-weekly, so over a course of 3 months. And so the practice we'll have is yoga, chair yoga. And so what this will do is we will be able to bring awareness to the pelvic floor. The chair yoga we'll do about 5 days a week for 45 minutes. So within that hour, we've covered the 45 minutes of physical activity with chair yoga. And we'll also include meditation for 12 minutes. So a little over that hour, so 2 minutes over. So meditation for the pelvic floor, bringing awareness to that space, because the importance of bringing awareness to the pelvic floor, one, that is where the pelvic floor is connected to that root chakra. If anyone's listening, they're saying, wait a minute, what is root chakra? What are we talking about now? So that root chakra, the chakras are the energy centers, and that is the base. And so the rectum is connected to that pathway, which is the root chakra. And so we're looking at that pelvic floor and bringing awareness to that space, bringing awareness that can help strengthen the bladder, heal the bladder with breath exercise and visualization. And will also reduce any anxiety symptoms with emotional freedom tapping. So tapping therapy. That technique was actually introduced in the early 1900s by Gary Craig, uh, who's actually studying under Dr. Callahan. So EFT tapping to support any anxiety symptoms, because like I stated earlier, anyone who's diagnosed with prostate cancer may have symptoms of irritability and anxiety. Now we look at the diet and the supplements. So to ensure that we're keeping a positive mood, we're not introducing supplements or foods that can cause even more irritation or a negative impact on the mood. And so we want to remove any alcohol or illegal substances. So because I'm not a dietitian or a nutritionist, I can only suggest the increase of dark leafy greens, so kale, spinach, arugula, even adding wheatgrass into a morning juice or smoothie. And speaking of drinks, I would also suggest, excuse me, hibiscus tea. Hibiscus tea is actually loaded with an abundance of antioxidants, and it actually slows the reproduction of cancer cells. I'll also invite another suggestion of chamomile tea, because that also calms the mood. And if there are any symptoms of anxiety or irritability, it can also impact the sleep or cause insomnia. And so chamomile can help reduce any feelings of overwhelm, fear, or anxiety. And that chamomile is also loaded with antioxidants, but it also impacts supports the mood for calm. And lastly, we take a look at the environment. It's important that we have a trusted group of family members or friends. Also, an invitation to work with a support group. Okay. Uh, Creating a clear space, so free of clutter. That clutter can also impact the mood by bringing more experiences of anxiety or overwhelm or upset. And we want to make sure that there's great sunlight coming into the living space or common areas. That can also help boost the mood and keep you on the path of vitality and the journey to overall good health. So recording, what I also do is record any current or past medications to ensure not to conflict with anything that the patient, client, student is already taking. So that concludes this episode. I hope you may have found this helpful. Again, feel free to do your own research. But I'm really excited to introduce more of the case studies that I'm currently working on and what it actually looks like when I'm working with a student client or patient. So I invite you to share this with anyone who may find this great benefit, who like it, or feel free to, start a discussion. Speaking of which, I'd like to also share that I have opened up space to sign up for yoga therapy with me. So if you'd like to discuss what that looks like, you can visit my website at nomoretraumayoga.com and click to book a session with me. And in doing that, you can either schedule a free consultation if you want to discuss what yoga therapy may look like for you. And if you feel that, I've already feel like this is something that I need, then you can go ahead and book a session. So Tuesdays and Thursdays from 10 a.m. to noon, you have an opportunity to book a session with me and we can discuss more. I look forward to seeing you back on this new series and feel free to let me know if there's any diagnosis or um, topics you would like me to cover, but I look forward to seeing you back. Remember to live abundantly, love your authenticity, and radiate organic happiness. But most importantly, live a life of no more trauma. Namaste. Bye.